Welcome to a day in the life at CHIGAMIK Community Health Centre. The word CHIGAMIK is an Ojibwe word that speaks to the notion of a people's place. So we are unique in the province in that we're tricultural and bilingual. So it's really incumbent upon us to understand in depth what our population is all about, the Francophones, the Indigenous, and the mainstream, and reflect our services to that understanding. So our staffing structure, our governance, and then the population, of course, represented a third roughly in terms of what we do. A third of who we are, a third of what we do is Indigenous. So we've designed specific programs. We have a traditional healing program. We recently received a grant for diabetes specific supports in a traditional way. And we have a perinatal mental health program.
I've been doing this work it'll be going on 20 years this year. The whole session is a ceremony, so we begin by smudging and using the sage to cleanse ourselves and purify ourselves. And the people are asked to bring tobacco, and we smoke that tobacco. We talk with the client for a bit and see what their ailments are, and my helper drums for me.
When I left university, I fell into depression, so the healers helped me with my mental health, but it helped me with my spirituality as well. I think the spirits talked to me through my painting, and that definitely came from Jake opening me up and opening my spirit back up so that it can breathe and and I can be more balanced.
We know from lots of literature and from my colleagues, the Indigenous healing paradigm is the pathway towards building trust with Indigenous communities so that they reach out to all the other services that exist.
The primary healthcare team here at CHIGAMIK is made up of 2 physicians, 3 nurse practitioners. We have some nurses, dietitian, health promoters. We have a lot of clinicians, and we work alongside the allied health team. We try to accommodate the client. So if, for instance, if a client comes in to see their primary practitioner, we try and set up a meeting if they need to that same day with a dietitian or social worker so that they don't have to come back and see us twice. When the client comes here, they have access to anybody that they want to see. We try to accommodate all their needs, not just their primary healthcare needs, under one same roof.
You have more access to services than you would have with a regular doctor's office. I guess you would have to wait for referrals and things. But as a senior living in a limited income, that's where I find a big benefit, that I can have access to services here I might have difficulty paying for myself.
When I first came to CHIGAMIK, I was fatigued, I was exhausted, I couldn't handle my bills, I couldn't handle nothing in my life. And now I have control of it all. It's all because of this place. I feel there's a big sense of community. They listen, the support is amazing, they care, and they meet your needs. You felt like you weren't alone.
Supporting people with health is good for physical health, but also for mental health. And our primary care providers often refer the clients to our mental health team. And we're here to support people who are struggling with all kinds of problems through one-on-one counseling, but also through programs. One of the programs that we offer here is Mindful Mondays, which is helping people developing a mindfulness practice in their daily lives.
I have been attending the mindful classes for almost 2 years. I just love it. It's just uplifting and very well helps you in every aspect of your life for thinking, getting you motivated, and just feeling well about yourself.
Un des services que nous offrons dans notre centre de santé, c'est le service de counseling. Mon rôle, c'est de desservir, entre autres, les francophones. Nous offrons à n'importe qui dans la communauté la chance d'avoir des sessions de counseling, qui est une approche surtout qu'on appelle une thérapie cognitive comportementale, autant pour des problèmes de dépression, d'anxiété, des problèmes d'addiction, de relations, on peut accéder au counseling comme ça ici à CHIGAMIK.
A great example of CHIGAMIK thinking outside the box and offering innovative programs that really serve the needs of their clients is through dance therapy, such as the Parkinson's Dance Program. CHIGAMIK is the only CHC, I believe, in Canada that is offering free dance therapy programs that are open to the entire community. This is really important because the majority of my clients are experiencing really serious challenges that make it very difficult for them to access programs if they were to have to pay for those programs. So we see that there really is a value in this program that is not just motor control, it's also serving people's mental well-being, and the feedback we get from people all the time has to do with their social well-being as well, their relationship with their partner and the relationships they're making with other people in the community.
Our healthy food programs such as the Miijim Market and Kitchen Talk were developed so that everyone in our community can have access to healthy foods, either for free or at greatly reduced prices.
A lot of the feedback is that just being able to have access to the Miijim Market and be able to come week to week, anytime throughout the year to get their fruits and vegetables is very important to the people that we're serving in the community.
What I like about the market is the prices, for one. The staff. There's nowhere you could get a bunch of bananas for 85 or 90 cents anywhere. I do most of my fruits and vegetable shopping here for the week, and I try to get here every single week.
The outreach part of my role as community health worker at CHIGAMIK Community Health Centre is about connecting with community members in North Simcoe who may be living on the streets, they're at risk of homelessness, and it's about developing ongoing relationships. I provide system navigation, advocacy, sometimes resources and referrals. I also provide access to harm reduction supplies and support in the communities we serve. We attempt to remove as many barriers to CHIGAMIK services by going in the community, sometimes with practitioners, continually meeting where people live.
The dream of CHIGAMIK was originally born with the Francophone community some 20-25 years ago. This community has had French-speaking people in it for many, many generations.
Le Centre de santé communautaire CHIGAMIK, c'était un rêve des citoyens il y a plus de 20 ans passés. On cherchait un endroit où on pouvait, ce qu'ils disent en anglais, one-stop shopping. Depuis les dernières années, on a de plus en plus de services, puis c'est vraiment apprécié.
The chance to do something significant in this community is amplified many times when you have strong and deep partnerships, and that's true for us with Waypoint.
So CHIGAMIK to me means a sense of family.
Teamwork.
Care. CHIGAMIK means my life.